Hello, everyone. Welcome to our webinar where we will be reviewing autism in the perioperative care led by Dr. Greta Duncan Wiebe. I'm Dr. Curtis Choice. I'm the Director of Ambulatory Anesthesia at Montefiore and Albert Einstein School of Medicine. I'm also the Medical Director of the Perioperative Medicine Clinic at Montefiore. And I'm very interested in this topic in particular because we handle this patient population as well in our ambulatory surgery center. So for those of you who are not SAMBA members, please consider joining the society as it offers many benefits to its members. And please visit our website at www.sambahq.org to see the benefits of membership. So we have a few quick housekeeping notes before we get to today's presentation. Please note that this webinar is listen-only mode. In the upper right side of your computer screen, you will see a GoToWebinar control panel. Through this control panel, attendees will have the ability to contact our staff via the chat and question boxes. We will have time for Q&A at the end of the presentation, but please submit your questions throughout so that we can prepare to answer. Now, at this time, I would like to introduce tonight's speaker. So as you already know, our speaker is Dr. Greta Duncan Wiebe, and Dr. Duncan Wiebe is an assistant professor of anesthesiology at the University of Nebraska Medical Center. She has served in numerous elected and voluntary leadership positions at Children's Hospital and Medical Center in Omaha, and is currently the medical director of the Children's Outpatient Surgery Center in Omaha, Nebraska. Greta graduated with her BS from Nebraska Wesleyan University. She received her MD from the University of Nebraska College of Medicine, and then attended the Medical College of Wisconsin, where she completed both residency and pediatric fellowship training. She was an attending at the Children's Hospital of Wisconsin for 2 years before being recruited back to Nebraska in 2009. In addition to her paid work, she is the mother of 4 energetic kids, aged 15, 13, 10, and 6, and has been married to her husband, Matt, for 22 years. So over to you, Dr. Duncan Wiebe.
Thank you for the intro, Dr. Choice. It's an honor to have been asked by Dr. Tobin to present tonight. 5 years ago, I would not have considered myself especially comfortable or knowledgeable caring for autism spectrum disorder patients, although I did it somewhat regularly. However, in 2017, as the medical director of our Children's Outpatient Surgery Center, we were approached by the head child psychologist at our hospital about using our surgery center for a pilot project to improve care for children with autism. A very generous donor in our community had provided seed grant funding specifically to make our hospital more autism friendly. I have grown to love and appreciate these patients, and especially their parents, and the tremendous commitment that they have to providing the best care for their children. So let's get started. So first of all, I have no disclosures. The objectives for tonight's talk. First of all, I will go over the diagnosis and history of autism spectrum disorder. And then we will review the unique anesthetic considerations for patients with autism spectrum disorder. And finally, we will discuss the perioperative management of these patients. So autism was first described by Dr. Leo Kanner, an Austrian-American psychiatrist, in 1943. He described these patients as children with extreme autistic aloneness, delayed echolalia, and anxiously obsessive desire for the maintenance of sameness. Kanner viewed autism as a profound emotional disturbance that does not affect cognition. The DSM-2, published in 1952, defined autism as a psychiatric condition, a form of childhood schizophrenia marked by detachment from reality. During the 1950s and 60s, autism was thought to be rooted in cold and unemotional mothers, dubbed, quote, refrigerator mothers. I can't even imagine the guilt that these women must have faced. The refrigerator mother concept was dispelled in the 60s and 70s as a growing body of work showed that autism has a biological basis and is rooted in brain development. The DSM-3, published in 1980, established autism as its own separate diagnosis and described it as a pervasive developmental disorder, distinct from schizophrenia. The DSM-3 listed specific criteria required for a diagnosis. It defined 3 essential features of autism, all developing before 30 months of age. First of all,